I'd like to introduce Commissioner Samuels from the Administration, Children, Youth, and Families at DHHS.
Good morning, everyone. So I wanted to use the little bit of time I had here today to really elevate the issue of exposure to violence and specifically around trauma and trauma-informed care. At the Administration on Children, Youth, and Families, I am responsible for both the Children's Bureau as well as the Family and Youth Services Bureau. And in that role, the Children's Bureau is responsible for the funding and support for child welfare systems across the country. And with the Family and Youth Services Bureau, we're responsible for overseeing funding related to domestic violence, the runaway and homeless youth population, as well as teen pregnancy prevention. And what's striking when considering each of those programmatic areas is what they share in common are children who are exposed to traumatic events. So whether that is in the domestic violence universe, where we know if a child is exposed to domestic violence, they're 15 times more likely to also experience abuse or neglect. Or you focus on the child welfare system, where, at least in Illinois, we were able to document that for children entering foster care, about 25% of them had a clinical level need around issues of trauma. In addition to that, if you look at the runaway and homeless youth population, what they bring to this table is both many of them have been abused and neglected prior to leaving their homes. And living on the streets in this country, is not anything if it's not a traumatic experience. Now, let's not necessarily confuse having a traumatic experience with suffering from trauma, right? Not all children who experience traumatic events develop symptomatology, a clinical need for intervention around trauma, but many do. And so part of what we're trying to promote at the Administration on Children, Youth, and Families is taking a trauma-informed approach across all of the populations that sit within my responsibility, and to develop common approaches and strategies to support addressing the needs that children have. We're trying to push the envelope by moving people beyond the premise that the best intervention for a child exposed to trauma is simply to remove them from the environment from which the trauma occurred, to really focusing on healing and recovery, to really begin to talk about what are the social and emotional impacts of trauma long term, and how do we begin to address the issue in a way that promotes healing and recovery so that we're more capable, not less capable, of sending young people off into the world capable of taking care of themselves, loving in a warm and appropriate way, and having a high level of functioning. So that's the basic premise we start with. And then over the last 2 years, we have looked for opportunities to integrate trauma into both policy as well as funding. So for example, in the recent reauthorization of Safe and Stable Families, which is really included in what's considered to be Title IV-B, those are the funds that are dedicated to child welfare agencies for the purposes of providing services and interventions. During that reauthorization, we were able to work with Congress in order for them to include language in the bill, throughout the bill, talking to child welfare agencies about recognizing the need for addressing trauma. So from a policy standpoint, we now have a policy in child welfare that says trauma is a critical issue, all states ought to be looking at it, and they ought to be thinking about what are the most appropriate ways to address them. In addition to that, we've been able to use some of our discretionary spending to also incentivize moving child welfare agencies towards an approach that is trauma-informed. So in the last month, we were able to announce a little under $3 million in discretionary grants, specifically for the purposes of building the capacity of child welfare agencies to recognize issues of trauma and to effectively intervene. We're hopeful that if Congress provides the kind of financial support that they have in the past, that we will, in the coming year or two, have resources to also address issues of trauma in the context of the domestic violence universe. So we have been working with the Domestic Violence Caucus and others to really look at this issue of how we integrate trauma into our understanding of children exposed to domestic violence and how we help women who have been abused also heal and recover related to related to trauma. And so, we're moving in the right direction. Lord knows we've got a lot of work to do, but we're raising the issues from a policy standpoint, we're raising the issues from a practice standpoint, and we're raising the issue from a funding standpoint. So we think that moves in the right direction. We're also working closely with SAMHSA. When you look at where the greatest knowledge is about this issue, look to SAMHSA. And so we have been working with SAMHSA to be a thought partner as well as a supporting agency as we go forward in trying to implement trauma-informed care in foster care. So I mentioned that roughly $3 million that we were able to fund this year. In addition to that, SAMHSA has agreed to partner and provide the resources to provide the technical assistance to those grantees. So it's an opportunity for us to leverage the knowledge base that SAMHSA has, the expertise that they have, with the resources that we had available to us through the discretionary grants so that we could, in partnership, move the field forward. The last point that I would make is that when you look at the brain science, there's little question that maltreatment, said differently, trauma, has a long-lasting effect. When you look at the child and adolescent needs and strengths assessment that we used in the child welfare system in Illinois, we saw about 25% entering the door needed help, and over time we saw that issue grow so that it was more like 40% for a child who had been in care for more than 2 years. But let me circle around to the last point that I want to make here, and that's this. I think there are a lot of different directions we could go in terms of realizing the full potential of trauma-informed care. I think that we ought to drive forward as quickly and aggressively as possible. However, it's a lot of work. Training staff, training foster parents, training frontline workers and investigators and social workers is a lot of work, but I have the benefit of knowing that it's completely doable. So we introduced a trauma-informed curriculum in Illinois in 2005. We trained every foster parent in the state and every caseworker in the state. We introduced 3 evidence-based strategies around trauma, and we did them in every region in the state. So whereas I can talk to you on this really high level about brain development, I can talk to you at a policy level, but I can also talk to you at an implementation level. There's nothing that I've described here and nothing that we'll discuss over the next hour that isn't imminently doable if we have the focus of resources, expertise, and the patience to do the work focused on implementing these policies, practices, and procedures in the right way so that we get the most from the limited resources that we have available. Thanks.